Hello friends, today we will be talking about the first trimester of pregnancy, the do's and the don'ts. Now this time of pregnancy is the most exciting for any mother because she's just got to know that she's pregnant, and also she's excited considering her future, and at the same time her body is changing, so she would have to face a few problems here and there. So this video will guide you what are the do's and don'ts of pregnancy. Now once you come to know that you're pregnant, it's important to know which obstetrician you would like to show or which hospital you would like to consult, because it is important. In case of emergency, you might need help, right? So the first and the foremost important thing is decide your doctor and give her a visit. Once you have decided and paid a visit, you would see that many of your queries would be answered. In this video, I would like to tell you what are the important things that you need to do as soon as you diagnose that you are pregnant. Now first and foremost is the folic acid, which is very important. This is it's a vitamin which is helpful in the baby's brain development as well as the development of the baby's spine. So it has to be started and continued throughout pregnancy or as advised by your doctor. Now importantly, we should be very much considerate about our diet, what diet we take. It should be nutritious, homemade food which is less spicy and oily, and also which should have adequate amount of fluids, approximately 2 liters of fluid that has to be taken so that it does not lead to dehydration. In case women feel a lot of nausea or vomiting during pregnancy, they need to visit their doctor for any medications that would help to prevent this problem. So the dictum in pregnancy is to have multiple small meals or small frequent meals. So we normally tell the patient that increase your number of meals from 3 to 6 and have it more frequently. That would help you to sustain for longer periods without bloating and acidity. It's important to take adequate rest in pregnancy because you know that the body gets tired early. So what you need to do is you should have a good night's sleep. Apart from that, you should also go for a rest during the daytime. Now this is the most important part of your pregnancy, and this is a period between your last menstrual period as well as the 12 completed weeks. So the most formative part of pregnancy, where from a tiny embryo the baby has grown into a fetus. That's very important. Now different organs are forming, everything is going on, and apart from that, bodily changes are occurring. A number of symptoms like constipation, increased frequency of urine, burning micturition sometimes, and acidity and epigastric pain are very frequent during the first trimester. So I will do another video which will describe how to manage these issues. But today, what are the things that you don't have to do in the first trimester of pregnancy? Now one important thing that you should avoid is avoid fast food, avoid street food, avoid outside food, avoid heavy oily meals, because this can lead to acidity and bloating. So better to have less spicy food and homemade stuff. It's important that we avoid any kind of medications, extra medications in pregnancy. So that's the basic reason we tell them to avoid outside food, because otherwise you need to take antacids or analgesics or anything, to relieve your pain. So which is not called for. The second thing that you need to avoid is self-medication. I've seen a number of women taking, analgesics and painkillers when they're not pregnant, and they have this habit of taking it during pregnancy as well. So I guide you not to do that, because that can lead to harming the baby. Then a very frequent question which is asked is that, is caffeine good for me? Can I take coffee? Yes, of course you can. 1 or 2 moderate, small or moderate amounts cups of coffee can be taken, but not excessive or multiple cups of coffee, because that can lead to problems with the baby. Certain fruits, like for example raw papayas and raw pineapples, we usually avoid taking in pregnancy because that it has substances which can lead to development of uterine contraction. So we usually tell the patient not to have it. So this is important. Now this small information is will help you a long way to manage your first trimester properly. And of course you need a guiding hand, a guiding help during this time, because for first time mothers, it is a different feeling and phenomena altogether. So I would advise all mothers to book themselves early during pregnancy, which is very important. Sometimes there is a myth in the Indian culture that you can get yourself booked at 13 weeks in in the second trimester of pregnancy, and just they go to the doctor and straight away get a tetanus toxoid injection without any preliminary tests. So I would advise not to do so. Please discuss with your doctor all the basic tests that need to be done throughout pregnancy so that you do not miss them. The first trimester, the most important tests that we do is first a viability scan, which is usually done at around 7 to 8 weeks of pregnancy, and we go for a thyroid evaluation, very importantly, and thalassemia screening, very importantly we do, and also a very important test for screening of aneuploidies, that is the NT scan and dual screen, which is done at around 13 weeks of pregnancy. So therefore, we should discuss with the doctor all the basic investigations that need to be done throughout pregnancy in the first trimester itself, so that we do not miss any of those. I hope you liked the video and I hope you gained from this video. Thank you so much.